Good afternoon, Lisa.
Hey,
Hi, Jennifer.
Hey,
Joe, that didn't sound good at all.
yeah, I just switched over to my hotspot because it's like storming over here. And yesterday my internet like would not work. So I'm hoping that this goes okay.
I gotcha. Totally get that. Totally get that.
all right, Jennifer, I asked you a question. Does Albemarle need 5 for quorum and Charlottesville needs 4, right?
Yes.
Okay, I just want to make sure. All right, so Mary's coming.
I'm just eating, so I will put my camera on when I'm done, but I'm here.
Okie dokie.
So Lisa, I did have a random question. So when we go into closed session, we'll cut the recording off. But if there's somebody that's joined live, like, how would we know that?
They're gonna pop up under attendee.
Okay.
So I've got to try to keep an eye on that. And hope to God that nobody does, because I'm not sure I know how to move them out of there, but I'll figure it out.
Okay. So it's not like somebody could just watch, like we would know if they were in there.
Yeah, the only way they can join is they have to use the either the private links that I give y'all, or they would have to use the public link.
Okay.
And
Like if
frankly,
that
they would
Sue
have to go to the
Moffett tried-
CSA website to get that.
Okay.
Like if that Sue Moffett tried to join us.
Yes, but we let her, we know her.
We let her in, and Mary we
Yes.
let in.
She's on the list.
Yeah, she's on the list.
Nita's in the waiting room or in the attendee. She's an attendee.
Not be prouder than being on this.
Yep, I'm letting her in.
Nice waiting room.
Okay, Charlottesville has a quorum.
Start.
We need one more. Albemarle. Kevin, we have a quorum.
Right.
All right. Let's get this started. So this meeting is being held pursuant to and in compliance with ordinance number 20-A16, an ordinance to ensure the continuity of government during the COVID-19 disaster. The opportunities for the public to access and participate in the electronic meeting are posted on the Albemarle County website at www.albemarle.org/community/county-calendar. Participation will include the opportunity to comment on those matters for which comments from the public will be received. For roll call, just state your name and agency as I call you. This is Nita Davis, the Albemarle Chair, Region 10. Sue,
Sue Moffett, Charlottesville Department of Social Services.
Katie,
Katie Ralston, CSA Coordinator for the City of Charlottesville.
Mary,
Mary Stebbins, Albemarle County Department of Social Services.
Aaron,
Erin Callis, Charlottesville Albemarle Health Department.
Jennifer,
Jennifer Wells, CSA Coordinator for Albemarle County.
Misty,
Steve Graves, Director of Human Services for the City of Charlottesville.
Kevin,
Kevin Kirst, Albemarle County Public Schools.
Martha,
Martha Carroll, Court Service Unit.
Krista,
Krista Gallio, Court Service Unit Program Rep.
and our CPMT Secretary, Lisa.
Lisa Jordan.
All right. Did I miss anybody? Okay, let's move to our first agenda item, which is approval of the consent agenda, which consists of the May minutes and the financial reports. Are there any edits to the consent agenda? Discussion, comments? Okay, then that goes approved. Right, Jennifer? We don't need to vote on a consent agenda, is that right?
You do
We need a
need a
motion.
motion separate.
Do
for
you
the-
need a motion? Okay,
Okay.
can I get a motion for the consent agenda? From
Oh,
Albemarle.
Just kidding.
So,
Was that Martha?
yes.
Second for Albemarle?
Erin seconds.
Great. Any discussion? Anyone opposed? Okay, that passes. And can I get a motion for the to approve the consent agenda from the city?
So moved.
A second from Sue.
Anyone opposed? The motion passes. All right, so the only thing we have on our action item is the revision requests that were sent out for Liberty Point and Bear Foundation.
There was actually a third one for Family Preservation Services. And these were all pretty just straightforward. The county attorney was fine with it, so we're just bringing it here.
Any discussion needed or questions? Do we need a motion to approve those amendments from the city and the county? Okay,
Just the county.
just the county. So do we have a motion to approve those amendments for the county?
I move to approve the amendments.
Second,
Second. Erin.
okay. Is there anyone opposed? Hearing that, the motion stands. Thank you. And now we are at the part of our agenda where we are going to go into closed session as we have two private provider applicants for Albemarle CPMT.
Cutting off the recording.
Do you need go into? I move that CPMT go into closed meeting pursuant to sections 2.2-3700 and 2.2-5210 of the Code of Virginia to consider two applications for CPMT private provider reps being reviewed by CPMT for Albemarle and Charlottesville. Now the recording goes off.
Okay.
I move that the Community Policy and Management Team certify by a recorded vote that to the best of each team member's knowledge, only public business matters lawfully exempted from the open meeting requirements of the Virginia Freedom of Information Act and identified in the motion authorized in the closed meeting were heard, discussed, or considered in the closed meeting.
I have to do a vote. So
So
Aaron,
Yes, agree.
Jennifer,
Yes.
Sue,
Yes.
Nita,
yes,
Katie,
Yes.
Mary,
Yes.
Misty,
Yes.
Kevin,
Yes.
Martha,
Yes.
Krista.
Yes.
So we're good. We're
Thank
out
you.
of closed session.
All right. Well, we've come to our part of the meeting that turns into the retreat, and we're 12 minutes ahead of time. You're welcome, Misty. I'm going to turn it over to Misty, who has graciously agreed to facilitate our retreat discussion on the groundwater training, which was just fantastic, I have to say. I thought it was wonderful.
Well, thanks. Yeah. I think the key to this facilitation is obviously group participation and folks being as vocal as they can and communicate with the group sort of how the training sat with them and sort of the lessons learned or aha moments and how we might want to take the information that we heard yesterday and apply it to our local context. That's sort of the goal of the sort of debrief is how do we take this body of knowledge and the experience that we had yesterday and apply that here locally and even more proximate to the problem, just kind of drilling it down ourselves, our individual organizations, us as CPMT and here in Charlottesville and Albemarle. Just wanted to acknowledge that, that the training yesterday was a lot. Was everybody able to attend the training yesterday? No, not everybody. Okay. It appears that there may be another opportunity for folks to attend the groundwater training, but there will be some, hopefully some parts in which you feel like you can contribute even though you didn't get the content yesterday. So I sort of thought to sort of keep the facilitation pretty simple. And one of the prompts that I like to use is the what, so what, now what method. Have you guys heard about that? Okay, so you start with the what. What is it that was discussed? What is it that happened? What did you learn? What did you like? What are the facts? What happened? And what did you learn? And then the so what is how do we make meaning of that? So what did that mean for you? How did that land with you? So what does that mean for our community and the people we serve? And then the third phase of the now what is how do we transition to action? How do we put the what, so what into action? And now what are we going to do having had this learning and experience and making some meaning with it? How are we going to transition to what action steps we want to take? And hopefully that'll sort of segue nicely into looking at our work plan. But that's sort of how we'll get started. Any other thoughts, questions, comments, feedback? I did my best to take notes yesterday. This was the second groundwater training that I attended, and it's still just a dense body of work. But for folks who were not there, is there anyone that wanted to sort of share a summary of what the training was about yesterday for folks who were unable to attend?
This is the third time I've heard that. And this time I came away thinking that if I had to summarize it, it would be that if you don't have anti-racist policies, you'll never have an anti-racist organization.
I think so. Other summaries? What
Uh,
happened yesterday?
I mean, one of the things I walked away with was so much more working knowledge of systemic racism from just a broader perspective. I know that and knew those things, but the examples and data that they shared to untangle the socioeconomic unfairness with race unfairness, the way that they untangled it for me was something that I felt. I never thought, oh no, there's not racism, it's just a socioeconomic difference, but struggled to use language to describe that to other people. And so I felt really empowered to be more anti-racist because they were able to share data that separated out socioeconomic privileges that have impact and pull those out so that what is left is pure racial biases, mostly unconscious. I thought that was just so well done and a difficult concept. So I walked away thinking, if you don't see it, you can't fix it.
Mhm. You said that.
And like that message just drilled in from a systemic organizational kind of way that includes disaggregating data in a painful way, but we can't fix it unless we disaggregate data and do the kinds of things that they were doing. So that was my sort of takeaway and experience. And I've had lots of DEI trainings. And this one brought a much more systemic view than I've had in the past. So that's why I really appreciated it.
So one of the sort of kickoffs to the training yesterday is this groundwater metaphor. And they talk about, say you're going for a walk and you're going for a walk and you are walking past a pond and you see a dead fish in the pond. And you may wonder, well, what happened to that fish? Like, what's wrong with that fish? What happened to it? And continue on. But your curiosity at that point is with the fish and what's wrong with the fish? What happened to that fish? But the next day you go back and you on your walk again and you pass less than 24 hours later, you go and pass that same pond. But the next time that you're there, there's 150 dead fish in the pond. And then at that point, some of the thoughts that may come to mind is, well, what the heck is in the water? And there's something wrong with the water that they're all swimming in. And you may be less curious about the individual fish, but what's their experience in the water that lended 150 of them to now be dead. And it's more of as an analogy that the racism is systemic. It is the container in which our citizens, residents, people that we serve are in, and we're all in helping professions. But if we continue to just look at each individual's problem, each fish's problem, or what's challenging them or what's ailing them, then we're missing the bigger picture, which is you got to fix the water that they're in. You have to attack the systems that lent to this problem. That's sort of the analogy that sort of kicks off groundwater. And going a little bit further, they talk about the groundwater 80% of the water that's on the earth is underground. It's water that you can't even see. So just sort of speaking to the intensity of how racism is so pervasive and so unseen and under the surface that we are living in all the time, just thinking about that analogy, that 80% of groundwater is unseen. And so it sort of takes you to this analogy, especially it resonates for folks, I think, like us that are in helping professions and are dealing with problem solving on a day-to-day basis. And so much of our work is client focused and client centered. But when we do that in absence of thinking about the groundwater, we're not really moving the needle for the entire system in which these issues are coming from. So for those folks who weren't there, I don't know, how did I do? Is that it? Did I get it? Okay. Other thoughts? What did you like about it? So it sounds like, Nita, you liked the data, like the massive amount of data, chart after chart of, okay, it's the other thing they cover is they cover all systems. So they cover education, and child welfare, and juvenile justice, healthcare. I'm missing another one.
Economic outcome.
Economic. So they cover all of the systems. So it's basically irrefutable data.
Yeah,
that
I'm not a huge data person. And so I was really liked the way they made the data understandable. And I've never seen it just was really masterfully done the way there's lots of beliefs that people have that aren't wrong. And they were able to show, yeah, you're right about these things, and then pulling out data to show where the systemic racism actually lies, like the piece. I just thought that was fascinating when they talked about Texas. When you look at the school systems, and we all know that students of color are often overrepresented in, I don't talk school talk, Kevin, you can help me, but suspensions and getting in trouble, right? And we've seen that a million times, like, oh, why are they overrepresented in amount of suspensions, people of color? And then the way that they back that up to combat some people's view of, well, maybe they're in a lower income area, so the parenting isn't as good because people are stressed out. And then they took data around suspensions or expulsions that were mandatory, that we would all agree are high-end discipline issues, threats to other people, bringing a gun, drinking on, things that schools have to. And when they pulled that to show that that was not this overrepresented, they did it specifically on Black males, that the Black males were getting the most discretionary penalties for breaking school rules, but where the schools don't have discretion, larger offenses, Black males were not represented as the highest offenders. And I just thought that was masterful, is to think through how to use data to dispel beliefs that maybe we in this room don't have, but that I know a lot of people have, people who maybe aren't as exposed to as much education information about this. So I don't know if that was clear, but for those of you who saw it, you know what I'm talking about. Like, I thought that was a really important way to use data and think through what the data may be accidentally showing or not true things. Blown away by infant mortality, infant deaths, that they took education to show that most of us know that, you know, the more education you have, likely the death rate of a baby, an infant death rate is going to be lower because what? People get more information. They have better jobs. They have more time. And we're thinking they get better insurance. And to show that, you know, a white group, yes, infant mortality goes down on education. And in this group of people of color, it goes down too with education. But that when you take those grids together and realize that mothers, and I think it was Black, sometimes they pulled out Hispanic, but I think it was specific, but to a group of color that with PhDs, that they were coming in line with the same infant mortality rate of white people with high school education. I mean, that just blew me away. And yeah, I thought it was fascinating the way they also took, like, why would that be? And the whole concept of in medical system that doctors very subconsciously, not intentionally, are utilizing a wait and see mentality for babies, for people, with people of color, that they don't with white people. That they don't wait and see, they do automatic testing and they get all let's see what's going on. And then to see all those women of color weighing in on their personal experiences. Like there was an outburst of people saying, yes, they've not listening, not just Serena Williams, they didn't listen to, they don't listen to me, I almost died. There was like 6 or 7 women within like a 5-10 minute period that's weighing in on the same experience. And so I thought that was just.
I was affected by that too, but I was also I was surprised how validating that was for people, that seemed like new news. So that was a good takeaway for me from the day, that, you know, it is new news to folks, and we haven't done a good job of making sure that everybody has this lens when they enter when they come to work for us, right? So yeah, that was really moving, the chat during all of that.
Yeah, I agree.
Talking about like the format of the training, I liked that part, but what stood out to me was that when I assume women of color were sharing Yes, Me Too, there wasn't really a space to hold space to acknowledge, like, is everybody okay? There's a weight here. Do we need to pause? There was like, no, there wasn't, the way that training is set up, there wasn't really a pause to take care of folks in the room. And maybe that would be different. I mean, thank goodness for the chat, or somebody might be just sitting in the audience having those thoughts, you know, so there was some solidarity, I think, in the chat, hopefully was felt in the chat for folks, but that was a standout point for me. And I think in addition to that, they were saying the only thing that's going to help the infant mortality of Black babies is having a Black doctor.
Yeah, that was, well, I mean, I was home and off camera, and that was upsetting. They didn't just say that, they had studied that. And the only factor that they found that made a difference in infant mortality, as we were looking at it, was the race of the doctor. That is just.
And as a white woman, it makes me challenge how I do my work. And if I don't look like somebody that I serve, and how may I be influencing that? If a white doctor, and they were, you know, very clear to say, we don't believe that doctors wake up saying that they're going to discriminate against babies. And I would believe that the people in this room don't wake up saying that we're going to discriminate against the people that we serve that are of color. But it's in there unconsciously. And if you're not aware of it, like if a white doctor or a white practitioner like myself, like doesn't see that data, then we don't know that information and we can't do anything about it. So it does, even though it's hard to hear that, it's important to know that.
Well, it also speaks to, we know that access is a problem, right? Healthcare access. We can work on the access and that's important, but the implicit biases that healthcare providers, including us, has to be worked on as well. Like just increasing access obviously does not save enough babies, as an example. So it's both things. And they did that with schools too. They had data to show and kind of gave an example of teachers, that teachers have implicit biases that they're not aware of and they don't intend to at all. But it's been proven over and over again. So of course it's in therapists and healthcare workers and social workers.
Erin, you attended the training and I was just curious because there was a lot of healthcare talk yesterday. How did that resonate with you?
So, like, I will just say for 1 minute for what Nita just addressed when it talked about those 4 child actors, that to me, I don't want to say it startled me, but to just hear it, right? And then, kudos, I don't know what better word to say for the teachers to say, yes, we'll sign it so that you can publish this data to what you witnessed with what the actions were, was tremendous to me. So none of you would probably know this, but I spent a long part of my career in labor and delivery. I was a labor and delivery nurse. So it does speak to issues where you sometimes would say to somebody like, I'm gonna, for anybody that's ever had a child or participated in a childbirth, right? When a woman tells you the baby is coming, well, I hear that, right? I need to listen to that, right? Now, there's a part of me that probably thinks, oh, we just checked you 2 minutes ago and you're probably not. But there are other things, so I'm going to do a reenactment, like when people are going, and you think the baby is coming, for those that have, things along those lines. I got to listen to you, right? And I have to advocate for you. That's part of what my role is to make sure that I can be your advocate. I can do many things for you. And just, if it's just to say, hold on, let's see if it is time, and for anybody who's ever had a baby, and if I say you don't push, that's like me telling you don't eat chocolate, like you want it, right? If you're, like you want to push, right? But you do see at times where you'd say, she feels like she needs to push, or she feels like, I, as a nurse, I always listen to something just doesn't feel right. Okay, what doesn't feel right, right? And sometimes there was times when you had to convince people, I think you really need to check her, right? And even if it's just validation for the person to hear, okay, it's not that time. We need to wait a few more contractions, right? We need to get through things. Or my pain is terrible. What my pain, like I'm going to pick on Mary for a second. Like Mary might just be there and she's like, it doesn't really hurt, but her pain could be a 10. Whereas Jennifer's face looks like it's terrible and she could be 2 centimeters and Mary could be 9, but you still need to validate what people say. And sometimes I think in healthcare that wasn't always validated. So you have to say, we need to figure this out. We need to make adjustments, or, I'm getting wordy to say, or how people go through childbirth. Some people have 75 things going on and that's what they want. And other people are like, don't say anything. And to, just honor what people want. It doesn't have to be, it's what's going to value them for when they have that child, right? Or how they're going to manage it to make it through. So that was, even though I knew the Serena Williams story, I didn't know the part where she got herself out of the bed to go up and to tell them that she was having problems and they thought she was having anesthesia issues. Now, I get that, but if somebody came out of the bed in the hallway to tell me stuff, that is not right. Right, you got out of the bed. So then I felt ashamed for my profession, right? I'm like,
Mm.
you know, I need to go back to you who said it to me to figure it out. So more than likely, if you took her vital signs, something would have shown that it was not right. So it's staggering to hear all that, and then staggering to hear where we sit, and there's so much groundwater.
The actors, the professional actors study that both Nita and Aaron are referencing for folks who didn't attend, there's 4 pictures of children. They took 138 preschool teachers, and they had given them the premise that they were going to be watching for misbehavior in students. And it was a white girl, a black boy, a white boy, and a black girl, and they all had different, labels on them, but they fit the teachers with eye sensitivity, fancy goggles, and did not tell them other than to look for misbehavior. But what had happened that the results showed is that the kids were scripted, they were actors, and they were scripted not to misbehave at all. And so they were angel children, and the eye sensitivity rapid movement detected that the majority of eye movement was looking at the black boy as opposed to the other children. And because they sort of deceived the participants of the study, they had to get them to sign a disclosure to disclose the results. And all but 2, I think, teachers agreed to disclose it because they said, for our profession, like Erin is saying, for our profession and for other people, and it was teachers of all races. I think that's an important note, is that we're all swimming in this water. And so that was another point of note, that it was all races, and that's what the outcomes were. So we lost Krista, but Martha, there was, lots to talk about the juvenile justice and the that world. So anything resonate with you?
Well, I actually had a conflict and missed the first hour, which was really unfortunate. I also feel like I need to hear the whole thing again, like that it was so intense, it was hard to make sure I was getting it all. The justice stuff was not new. A lot of the school stuff felt like stuff I'd heard before. This stuff that was new for me, really, the infant mortality stuff was huge. The stuff about, I don't know that I'm going to say it correctly, but they both went to Harvard, they both have the same degree, but the white person's going to make a whole bunch more. I'm like, that was kind of shocking for me. And it was good that they kept saying it's not people aren't waking up in the morning to do this. It's not intentional. It's in the water. So I really need to hear it again. I think it was incredibly powerful. And yeah, those are my thoughts.
Sue, anything come to mind from the child welfare?
Didn't say she's having trouble. She got kicked off and is having trouble getting back in. I don't know if anybody can help with that. Lisa, I don't know if there's a fix for that. I got kicked to get back in.
I think I just made it back.
Okay, I was gonna say, I see her square.
So for child welfare, it's, of course, you're a little bit relieved when you see that the difference is narrower than in other aspects of the system. But also, we had done some research through with the UVA on our child welfare caseload and found pretty similar things in that once kids are in the system, there is not much disproportionality or disparity relative to their outcomes. But the getting in and how long you're in, there is a difference, a big disproportionality. So it's, and Mary, I don't know if you guys have your data yet. I know you had started something similar with just before the pandemic.
Yeah, ours was similar as well, just what you stated.
Um, Katie, were you able to attend yesterday? Did you have any other thoughts or takeaways?
Yeah, no, I mean, I think, the general idea of the training wasn't like some big news flash. I think just because of the line of the work that we do and the work that we've done around it. But it was interesting to see data after data, research after research in different fields to support what they were saying. I thought that was interesting. But yeah.
Jennifer, were you able to attend yesterday?
Did. So, yeah, I mean, I think like Katie said, it sort of felt for us a little bit like information that, we've seen, because like when we looked at the CQI tool last year, you guys pointed out that discrepancy that you could see in the race. And so I feel like in some ways it was sort of a confirmation to know that it's not just like a local thing that's happening, but it's clearly much bigger than that. And in some ways it feels like, oh my goodness, like it's so much bigger than just, how do you even begin to address something that feels so big? And that's really kind of how I felt when all that data was coming at us, was just like, oh my goodness, this is like way bigger than what I can do or what CPMT can do. Like it felt really big. But what I liked was the part about the superintendent or the principal or whoever it was that set that policy that said how those kids were going to get into that gifted and talented. And it removed the people factor, right? And so in my mind, I was like, okay, there's one small step that you can take that it removes that person factor that gets to affect certain decisions that get made. And so with that little piece, like I felt hopeful, like there maybe are things that we can put in place to help address these things that happen subconsciously, that happen outside of where we're operating or where we think we're operating. So I appreciated that one kind of little example that came out of it.
Yeah, anytime that there's like a discretionary decision point, so whether it's discipline or whether you get a referral for gifted and talented, as long as it's up to a teacher, counselor, police officer, like individual discretion, that's where things can go sideways. So the more objective that you make it, the better outcomes for everybody. That's a great takeaway. Well, transitioning to the so what, we sort of talked a little bit about how this sort of makes us think and feel differently and what we might want to do. What does that mean for us as an organization, or you as an individual, as a practitioner helping professional?
Well,
I think
one obvious thing is we can be more transparent about disaggregating our outcome data by race. Not just outcome data, our inputs too, by race.
And what would that do for you and your organization?
It would ensure that everybody's looking at our programs and services and systems with the same lens. Like this is what's going in and this is what's coming out. And I think that would that's a necessary first step in order for us to bring about change. I mean, I was really surprised yesterday how many people, hadn't been to that before, because the first time it was offered in our community was 2018. And also like that they were surprised by the data, and that was good for me to hear, because I haven't really been thoughtful about that or sensitive to it.
One of the things yesterday that I liked that they did, I think we mentioned this earlier, is they kind of took out other factors that people would say, well, what if it might be this that's contributing to that? Or what about this? You don't know that it's not this. So if there's any way, for us to do that with some of our data too, I think that would be helpful. I don't have a specific example, but I appreciated that, because it kind of dispels some of those other claims folks might make.
The comparing apples to apples, and the trainer was like, and not just apples to apples, but galas to Honey Crisp. So what you were suggesting, Katie, is like the outcomes, but disaggregated by race and socioeconomic class and address and,
Whatever,
job status.
To get rid of some of those other, factors that people would say might be contributing to these outcomes. I don't know how we do that, but it would be great if we could figure that out.
Yeah, one thing we tried after our first research project, which was on the disproportionality in CPS, on our CPS caseload. So one thing that we looked at is where are the areas where we exercise discretion. And so first of all, it was at referral validation. And so in response to the initial data analysis on that, we tried this blind referral process, so that every referral before it was validated was staffed with a team of people without any demographic information. The name wasn't shared, the race wasn't shared, the address wasn't shared, the history with the department wasn't shared, and that took a lot of infrastructure to support that, and we just didn't have the number of cases coming in for it to really be sustained. But if there is an easier way to do that, I think that would be really interesting to me.
Yeah, I think about, just like I think mostly about FAP, that's, where decisions are being made in terms of our CSA program. And just thinking about all the demographic information that we see as a FAP team. And, like, is there reason to have that on there? Would it be helpful to not have that on there? I mean, I think, the reality is we have to capture that information and report it to the state, but just in terms of what FAP's job is, and I do think our FAP does do a good job of trying to be consistent and trying to be fair. But just having that in front of you, does that make a difference? So just thinking in terms of our CSA program, what we could do.
And I think the so what of that is taking that extra responsibility to eliminate bias. If what, the data is showing us is that it's all, not all, but the data that they're showing is unconscious implicit bias, then we have to measure it to make sure that we're being as vigilant as we can be. And what you're saying, Sue, is like, that's how you measure equity and how you hold people accountable.
And so the now what step was that we tweaked our mandated reporter training a little bit and added some information about buzzwords, like have the crazy family over, at this, in this housing area did this again, that we've just tweaked our mandated reporter training to try and make it to address implicit bias.
Any other so what's? So if we've had this experience, we know these numbers, we know the stats, we know what the data is telling us. So what does that mean for you and your organization?
I'm struggling with, I guess, still the what or the problem, and I'm okay to move on and maybe people can fill me in, but what are the reasons from a state perspective, from Albemarle County and Charlottesville, when we look at this, you know, the data, why are people of color so overrepresented in, you know, foster care prevent, like overall? Like, I mean, I see it as, it's not just one organization, it's across the state when you look at this. And so, I mean, I know lots of reasons, but like, I appreciate that once they enter the system, you know, we do everything we can to make sure that it's fair. And maybe that's just our sphere of influence that we have and can make sure. But to me, like, it would be like not entering the system. Like, wouldn't Virginia, and is that already a goal and it's being worked on, Nita? You're not the first to think it up. Yeah, that's what I figured. So can you fill me in there so I don't just live in this area of, why wouldn't we have a goal? We just want to reflect the population. You know, we would want 13% of our kids to be African-American because that's what they make up in the city of Charlottesville, or reflect the population goal of entering into the system. Is that, why wouldn't that be the goal? Or is it already?
So that really is the goal of a lot of the Georgetown work. If you look at the goals of their capstone project, the first one is about pre-booking diversion. And that's about having work with the police and Misty's agency on the front of the system with kids and families before they ever get to us. Because if you get to us, then you're one step, you know, you've got one foot in the system, which is where we don't want people to be. I mean, part of the problem for us with that is that we've been hampered by the political stuff in Charlottesville. You know, you still have an interim police chief, you've had turnover there. Things have been stuck for, you know, Krista, correct me if I'm wrong, but I feel like those agreements between Human Services and CPD have been stuck for like 18 months or more now. So we're working on other parts of the project, which are really important, and hopefully have that race equity lens on them. But we're missing that front piece that's really, really important. And yeah, so how do we get that going? And some of that's bigger.
So what you're saying, Martha, is in the juvenile justice through the Georgetown, they're really working at diverting kids or having diversion prior to entry, and we've been lagged because of city. I get that.
Yes.
Is that true also in child welfare? Is there a stated goal in Virginia or by Albemarle and Charlottesville that we want to reduce?
And just to back up, Nita, it's not a, I mean, it'd be great if it was, but it's not a Virginia goal. It's a Charlottesville goal, hopefully to be broadened to Charlottesville and Albemarle. But it was our reason. I mean, it all came out of the DMC work that was commissioned by City Council from 2012 to 2017. And we took that knowledge and we applied to the Georgetown program. And then you come out of that with a list of system improvements you want to make. And what I was just describing about pre-booking diversion is the front end of that we're so stuck with.
What about child welfare?
Yeah.
Is that true for child welfare?
The city does not have a goal relative to race about preventing kids from coming into care or into the child welfare system, but the practice is to prevent that and divert kids from foster care and to strengthen families.
I guess wouldn't we want to prevent them from touching child welfare at all? Like, we don't even want them to come into foster care. We don't want them to come into foster care prevention because that's probably going to feed more foster care. So does the city back it up to, no, we don't even want them coming into foster care prevention? Or does that feel that that's where we end? Or, you know, because that's where I feel like our problems are, is entering into the system.
Yeah, and it's a, you know, then I think there's bleed between the child welfare system and the rest of the safety net programs. But, you know, one thing that this group has done, and Krista can speak to Chrissy or Katie can probably speak to the details of this, but we have allocated some money to the schools to do some prevention work, to pay rent and things like that. So folks don't have to come onto our caseloads to get those kind of concrete need supports.
Right. And I think the work that we're doing as far as our non-mandated funds, I know we haven't been able to get together, but I think that will really help.
What now what are tied together. So I think we can blur those lines a little bit. Especially since I think we're transitioning around 3:30 for the rest of the agenda. I'm not sure. I know this was supposed to be an hour. So outside of disproportionality, there are things that were talked about, especially I think the resume piece that Martha Carroll brought up. And this is a place where you would want to like bring in people of color to different organizations. And so I don't know if this necessarily is a CPMT issue, but if we, what are some thoughts about, you know, onboarding, hiring, those sort of topics?
Well, I know in Charlottesville, at least for our department, it's a challenge to diversify our staff. It's something we know we need to do, that we have been working on to recruit and retain qualified, particularly social workers of color. But it's definitely a challenge. And one thing we've done is, well, besides we have a refer a friend type of a bonus. But if you, we participate in job fairs at MSW programs through Norfolk State and VCU, and there's one other one, Katie, what is it? Or Misty, can you can't remember the third one. I'm sorry.
Virginia State University.
Jenny goes to Virginia State, that's it, yes.
This reminds me of the doctor of color being the factor in an infant mortality. So I just think about having a diverse staff that's reflective. If you have somebody of your race in the classroom, in human services, social services, you know, all the systems that were talked about, what if the same is true for all of the other systems as well? It's not just the healthcare field. And so I think that's something, a now what to consider as a CPMT. You know, we don't have oversight over everybody's hiring processes and things like that, but as a CPMT, we could perhaps support each other with recruitment ideas or hiring practices. I'm getting ready to do my first one of redacted resumes or redacted applications. So that's sort of the same idea as like a blind, what did you say? Blind referral process. So same idea. It takes a long time to redact applications. Thanks to Chris Baldo, say that on record. But you know, that's just something to consider.
I will say, this hasn't been agency-wide, but in the services that I supervise, when we do interviews, and I got this from I can't remember which training, it was one of those national trainings, but actually weighting lived experience and thinking of living as a minority as lived experience and weighting it in a way that helps level the playing fields, that it is important because of the demographics that we serve. It's something that you have to talk with staff a lot about and educate and talk through, but they do get comfortable. And in my shop, I know we have been hiring more people of color just by having that conversation regularly. You know, there's anytime someone's like, Nita, am I approved to hire? You know, I want to know the race. And I tell them I want to know the race because we know we have a more effective workforce that reflects the people that we serve. So repeating those kinds of things and the lived experience of racial trauma for many of the people that we're serving. It's hard to get that in policy. We have no HR director, so there's none to stop me at this point. But yeah, that has been a strategy that has been successful in the last 2 years of bringing on more mental health care workers, both clinicians and non-clinicians. And thinking through some of the jobs, do they have to have a master's degree? I mean, we've done a lot of that as an agency, thinking through, you know, yes, we always wanted this high clinical. And what do people with lived experience bring that high clinical master's degree license eligible people don't necessarily bring, or what's good enough to provide services?
I think the other sort of takeaway from the training is a reminder about they called it the weathering hypothesis, but just the impact of chronic stress that comes from racial trauma that is has poor health outcomes and an impact on that. And I think about cultures of self-care and spaces for people of color to support one another and how those systems are set up for that. So that's something that can be applied here and in our own organizations. Any other now what's? Assume that more now what's will come up in the discussion that we have with the CQI tool. And as we work to update our work plan. Any other thoughts, comments, questions? Kevin, how's all this sitting with you? I see that you're nodding and listening intently, but I know that you weren't at the training. So I just want to check in real quick.
Yeah, I mean, I'm much like Nita was asking, you know, we have all kinds of indicators and are working on not just staff, but the kids, right? With much like social services, like we're watching which groups of kids go into special ed, it starts right at let's push it all the way back to the classroom, much like your studies. Yes, we've heard of those and they're frightening. So no, I'm on board. I'm looking forward to the next opportunity to jump in to get that training. But no, I don't feel like I'm far off from the pack and where we're going. And certainly as an institution here, as the school system, I think, yeah, I think we're on board. So no, this is good stuff.
And Mary, how are you doing? Just checking in. I think you said that you also weren't able to attend the training.
I was sort of in and out in the beginning, and then I was out for the second half completely. So I caught little bits and pieces, but I didn't see much of it. Yeah, no, I think it's a good conversation and one that needs to be continued. You know, from what I did see, I don't know that it was any new thing or thing I didn't necessarily know, but I liked how it was really good and almost startling in how it was presented, right? Because the use of data and the numbers and the just showing the disparities, I thought was really effective. yeah, so, I mean, lots of ongoing work to be done for sure, but.
Is
Often
there,
thought-
is there a way, does DSS, both Albemarle and Charlottesville, do y'all capture how the referrals come to you all? Like, is it teachers or?
Yes,
Because it
unless it's
sort of
anonymous.
feels like, I know I'm trying for the, like, how do they not hit the system at all? Or do you say most of it's like, is there data?
No, it's not
there that
mostly
we can
anonymous,
see?
but unless they're anonymous, we know if they're a teacher, if it's from the schools, from the police, from the whatever, a neighbor, we know. And, and that's where the disparity starts.
Exactly.
And we have, and similar to the city, we have tweaked, we do mandator reporter trainings. We have, we have tweaked those, but I don't know how you stop that influx, right? Like, I don't know how.
I wonder if it's education on implicit biases that tags onto mandated reporting. I'm just throwing it out there. Is
Yeah.
that maybe it feels to me like, I mean, it's not a DSS. It's what's getting thrown at you. And that the implicit biases of those mandated reporters is what causes the overrepresentation, just like Martha's talking about, the same in the criminal justice, right? It's it's too much contact with police, too much calling, and so I just throw that out there. We can go on to CQI, but maybe that is a data part.
But we all contribute to it. I mean, I
Yes.
appreciate the notion that it's not DSS, but we do all contribute to it.
Absolutely. Yeah.
Now that we know that there's these resources out there, there's nothing to say that as leaders of this community that we can't encourage others to sign up for these sort of trainings and really spread the word and talk about our experiences with them and advocate for everybody having that. One of the opening things is like, raise your hand if you took a semester-long course on diversity, equity, and inclusion work. And it's crickets, because it's not been a prerequisite for us to get into the field, but it should be, at a minimum, something to make you qualified in order to be a practitioner or work in the helping profession. And so we could advocate for what those opportunities are and what we expect from our providers. What do we expect from our partners? We expect that at a minimum, that folks are knowledgeable about implicit bias or knowledgeable about these data courses. I mean, because like you said, you can't do anything with it unless you know it. So we can continue to advocate for the folks that we're working with, whether on a small organizational level or the partners, providers. We continue to do that work. I'm not facilitating this meeting, but I'd like to make a motion for a break, since we've been doing great for an hour and a half, and I'm wondering if anyone else understands that this is a 3-hour-long meeting. I'm not trying to be silly, but I would like to make a motion. I don't care how long it is, but I'd like.
Break would be lovely.
Yes, we'll second that.
All right. So we're going on break
For how many minutes?
for 5 minutes, 10 minutes. What do people want? Okay, it is
5.
5 minutes. So see you in 5. All right. So CQI tool yearly review. Misty, were you going to do that review? How do we plan on doing that?
So I didn't know if folks, we sent it out ahead of time. I don't know if I need to share my screen, if that would be helpful for folks. And then Katie is gonna note your observations as we go through this. So I think that's pretty much the bulk of what we need to do for this particular tool. If you have any questions, you can let us know. So let's see if I can do this. Sorry, guys, bear with me. I don't know what you all can see because I have dual screens going on.
We're seeing it.
Okay, so if I go to the next slide, does it change for you all?
It's still the same.
Still the same. Okay,
Front
hang
page
on.
right now.
Oh, let's see. How do I make this thing go to the next? All right, hang on. I gotta stop sharing for a minute. Let me try this again.
It's okay. I'm still trying to pull up the CQI tool anyway, Jennifer.
Okay.
Like, it's being really slow for some reason.
So. What do you guys see now?
Still the front page.
Okay, so I want to change. All right, I don't know. I'm gonna try this one and see if I can just switch it this way.
Now we're seeing your, that looks like it's gonna work, Jennifer.
Okay. So if I do,
Yep.
oh, why did it do that? All right, hang on. There we go. Did that work?
Yep.
Okay, thank goodness. So Katie, are you ready on your end? Okay. So this first slide is on the left hand, it's statewide. And then the middle is Albemarle, the other side is Charlottesville. And this is just a great big old snapshot where you can see FY 18 to FY 22. And again, it gives you the child count, the gross expenditures, the net expenditures, the average expenditures. There's no base match rate on the state side because that's set for each locality. And then you can see that back when the local match rate was set, which was, I think, when CSA first started, that's when these rates were set. They haven't been reviewed since. And so the base match rate for Albemarle is higher than Charlottesville. And there was all these factors that helped them arrive at what the match rate was going to be. So again, there's a little bit of a difference there. And then the rate underneath that is the effective match rate. And so this has to do with whether we're using community-based services, which has a lower match rate, or if we're using residential, which has a higher match rate. All of the special private day education stuff is at the neutral match rate. So certain services are just at that base match rate. So you can see all of that kind of, across fiscal years and then for each of our localities. So I don't know if folks have anything that sort of stands out to them or anything that you want noted on the CQI tool as you're looking at this.
Jennifer, the next slides kind of break it down more following the CQI tool, right?
So like, yes, the one was just kind of helping you see it a little bit. So yeah, we can definitely go through the slides. And Katie, I don't have the tool thing open. So if there's something that I'm missing, stop me. And we can ask the group.
Yeah, it's looking like they kind of go together, but if I need clarification, I will stop you guys and ask.
All right, so this next slide, again, this is statewide, and it's just, so originally I tried to put all of these on one slide so you could see like the state and Albemarle and Charlottesville, but the slides were way too small and you couldn't see anything. So I don't really have a way to show you all of these together. So it's just showing them individually. And so again, this is where you can kind of see the distinct child count, the net expenditures per child. This again is for the whole state. And then at the bottom, it breaks it down by service placement type. So there's special education, Fed RAP is there, and then foster care, independent living, next is residential, and then community-based. So that's the state. This next slide is specific to Albemarle. So as we're looking at Albemarle's numbers, you can see that. And I don't want to go too fast for folks. I don't like however much time you want to look at this. And then the next one's going to be Charlottesville.
I mean, the observation that I can see here is that the child count went down and the cost per child went down, which is a positive.
So just because I know one of the last few times I was here and we talked, like, is this reflective of kids receiving less services or needing less services, or that providers are still being hammered by right in the middle of pandemic or post-pandemic? Like, kids need the services. There just aren't providers to spend the money on. I'm just wondering that if that fallout for 2022 is part of that.
Yeah, I mean, a couple of things I would say is we obviously don't have year-end expenditures for
Right.
FY22 yet. So you've probably got some outstanding expenditures that haven't been posted yet that aren't going to show up until probably, well, I think the last that we can post for CSA is like September. I think that's the
Mhm.
last filing that we can do. So, I'm not entirely sure how accurate these numbers are.
Got it.
So it's going to be as of whatever posted, to OCS as of that date. And I think this report went to like towards the end of May is what it pulled from. So taking that into consideration, I think that would be a piece of it. And then I can show you the one for Charlottesville.
I do think in general, just from, observation of being on FAFT every week, our FAT caseload has certainly decreased. I mean, a few years ago, we were meeting for 4 hours every Friday. Now there's Fridays that we cancel because there's no cases to staff. And our meetings are maybe 2 hours. So like, I feel the difference in terms of the number of kids that are coming through FACT at least.
Yeah, and I would say for the county, it's really not been that way. I feel like ours has ebbed and flowed, but it's definitely been pretty steady. We definitely have seen, like I've said several times now, just a continued increase in CHIN's cases through Region 10. So we're continuing to see those.
I mean, obviously the city side has the same observation. I'm curious, I don't know this, but is there any sort of proportionality? Because obviously the kids that come into Albemarle Care are going to be higher than Charlottesville just because of the population difference. But is it proportionate in some ways to the population? Is that like about what you would think that the difference would be?
The difference between Albemarle and Charlottesville?
Yeah, so it's looked like maybe it's better on the first slide, but Albemarle has what, 240 and Charlottesville has 179. Is that in proportion to their population, overall population?
So that's a great question. I mean, I don't know if it's worth, again, I think some of this is we can take notes for things that would be helpful for you all to see. What I think is interesting in looking at just this particular side with Charlottesville is in 2018, you went from 433 down to 2022 where it's 179. So clearly there's been, like the city's seen a steady decline in the number of cases.
And to Nita's point, how do we make sure that, they're not even coming in? Obviously, there's been something happening to where kids aren't even coming in. A steady decline since 2018.
Yeah, I don't know if this gets to, I'm trying to go between too many tabs. The case type, is that in here, Jennifer?
That's a good question.
Mandate type, yeah, I think we get to that later.
Well, so the mandate type, I mean, like this is just going to give you like the demographic information.
Well, I guess I'm just curious, like if we've seen our foster care mandate type go down, why is that? And like if we've seen that go down, have we seen our prevention, foster care prevention mandate type go up? And what does that mean? And what are we seeing that's going on in foster care prevention that maybe could even, can we do something even before they come to foster care prevention? I could think is what Missy was trying to get at too.
Can I just ask a newbie question about this? And this shows kids for whom there has been a CSA expenditure, right? So it is, I mean, it's probably not a lot, but if we're just talking about a couple number of kids, it could really affect the way the pies look at the end when the fiscal year is closed out, right?
Mm-hmm.
So what I'm thinking is we can just go through these slides, and then if you all decide that there's something additional you'd like to see, we can try to figure out if there's a way to do that. Not sure if we can get it all done in this meeting, but we can definitely try. So again, this slide is just the statewide statistics on demographics. And like I said, I just wasn't able to get all this to fit on one slide or for all the different, this is Albemarle. And again, I don't know if anything stands out for folks.
What does referral source mean? Like referral to Albemarle DSS? That's what I was sort
No,
of.
to
Referral to
CSA.
CSA, like we're fact referral.
The CSA.
Yeah.
Oh, that makes sense.
So again, this is Albemarle, and then this is Charlottesville.
So just looking at the CQI tool for demographics, last year, the CPMT had noted that Charlottesville has a significantly higher disproportionate number of African-American children served and significantly higher number of males. And so I don't know if we want to comment on that.
Looks like that continues to be the case.
Say that again.
Looks like that continues to be the case.
I think a part of what you would keep in mind is when you look at these slides is, so of the kids that came in or that were represented last year that you saw, how many of them continue to remain receiving CSA services. And so that might be a reflection of why you're continuing to see that. But again, there isn't a way to break it down. I don't think there's a way to break that down within this, within what OCS offers to really show like how many of these are new cases, like how do you capture that? I don't think there's a way to do that. So anything else from folks?
There's not much else we can say other than that trend continues, right?
Yeah. And so again, this is just another one of the requirements to look at on the CQI tool, and it has to do with cans. So this is for Albemarle County. If you look, the green side is Albemarle, and then the black bars are statewide. And then this is Charlottesville's.
And so higher means better or higher? I'm sorry, I haven't read the cans. I don't know whether that is that a
Yeah, I don't know.
like, what are we aiming for here?
Yeah.
You know?
So I don't think these are, I think this is just saying in comparison to the state, this is where your locality is. So it's going to pull from every locality and give you that average. It's not like there's a bar set like here where you have like a target that you're trying to get to. It's not that way with the cans. It's just letting you see where you fall in line with the state.
But what
So-
does it mean though? Like,
So,
Are we
like,
doing better than the state or worse?
yeah.
so I think what it's saying is, for example, the Cannes school, where it
Uh-huh.
says Cannes school, I think what it's saying is, I'm just looking at the Charlottesville City one, where that was identified as a need in 2021 for, I think that says 40.1% of the state. It was identified as a need in of 21 or 23 point whatever for the city. I think it's just comparing what's identified as a need across the state and what's identified as a need for Charlottesville, Cannes City kids.
So only 5% of kids in the city had an identified behavioral or emotional need.
Yeah, I thought that was interesting because, you know, for the, you know, the other ones are much closer to where we are at the state than that one. That one really stands out.
Also seems counterintuitive, just given the impact of COVID on the social emotional needs of children.
Yeah, it is interesting. And it's, so I think these are lumped into, like, there's a set of questions about school. There's a set of questions about behavioral emotional needs. And then there's obviously a set of questions related to strengths. So it's not just one question. But that is interesting.
Where's the Albemarle one?
I'm not really sure what that means, but I'm gonna try and find out.
I think we also discussed last year, and again, it's been like 10 years since I've looked at the cans, but isn't part of the critique of the cans is that it's subjective to whoever is evaluating?
Yes, I mean, so on the cans, you get certified to be a rater. So there's a certification process, but once you've done that, then then you're certified to rate the cans.
Jennifer, can you go back to the cities one more time?
Sure.
Do you think, oh, I was looking to see if there was like, it said 5.39%, and I was thinking the decimal was just in the wrong spot, but I can't even make that better.
So this might be one that's worth just pulling up the report and seeing if there's some way to like drill down a little farther to see why that is. I don't know. But again, I think you can definitely make the note about it on the tool, and then we can obviously try to get more information, like kind of about that particular item. So anything else, or we good to get to the next slide?
Okay.
All right. So again, this is where the state does set targets for localities, although I think it's the same across the state. So 85% family-based foster care. This is Albemarle, and then exits to permanency is 86%. So and then I can show you guys.
The state didn't even meet their target.
What's
Right.
that?
The state didn't meet the target either
Oh,
to permanency. But Charlottesville is really close. If we round up.
so I feel like Charlottesville strengths is the kinship placements. I feel like the city does a really good job of that piece. And then on the county side, which I think you might see on the next slide, I feel like the county does a good job with ICC, with having ICC on cases. So that, again, this is Albemarle ICC, there's the target, and then the green is where Albemarle's at for that and community-based services. So again, I feel like continuing to do a good job of accessing community-based, where it's available. And then this is the city.
What does 100% ICC mean?
It means that you, of the cases that you have for ICC, like you've referred all of them for that service. I think that's what that means.
All 240.
No. So I'm trying to think, do you know, Katie, like how I know like parental placements probably might be like a type of case that gets looked at.
So my understanding was it's kids in residential. I think the problem with this data is it leaves room for interpretation and application depending on your locality. I know like traditionally we haven't, like if we have a kid who's in foster care, who's in residential, we wouldn't refer to ICC. Whereas that might be the expectation. But it is, based on your locality policy too, around who's going to get referred to ICC. So it's hard to compare to the state. Like it should be compared to what you say you're going to do, not compared to what the state is measuring. Like, do you make a referral on the cases that you say you're going to make a referral on? Is what we should be measuring.
So anything else that you want noted? Again, this really is just kind of your observations of what you're seeing as you're looking at this data.
Thanks, Jennifer, for putting it all in a beautiful, like, But
Yeah, and if there's other things, like I said, it's a little hard to try to do that, live, but if there's other types of data that you guys want to see or something that you want drilled down, that's definitely something we can like note and then try to get to and then bring it back.
So speaking of, do we have time to quickly just go through these different data points and take note of anything we would like to do further related to that data point really quickly on the CQI tool?
Yeah.
Okay. So the first one was number of children served. Last year we put continue to monitor. Obviously we talked about having fewer and fewer kids touch our systems is great. And so like we're trending in that direction. So I don't know that like if there's anything we want to do about that or anything you guys have to say about that further in terms of actions.
Is this a place where we want to note our intentions to look at the non-mandated pool? Or would that be at another place in the?
Yes, I think we could write that here. I'll add that. I'm gonna look at expanding use of non-mandated funds. And then a time frame around that.
Well, considering
one
it's
to get-
taken 3 months to organize the meeting, I don't think it should be too aggressive.
By this time next year.
great idea.
Okay. Anything around either total expenditures or expenditures per child?
I thought it was interesting. I didn't say this, but I thought it was interesting that Albemarle County spends $27,000 or 27 to Charlottesville's 19 or 20.
Per kid. Well, and I think last year we noted that might have to do with the number of special education private day placements that the county has compared to the city, because that would drive up the cost per kid. Anything that we feel like we need to do or can do about that?
Do we just need to check that that is proportional? Like it's because there are more programs in county schools and or more county schools than city schools? Is that?
I think if we can look at the referral source or the mandate type, we might be able to tell by looking at that. These numbers are so small. Sorry, I feel like I'm having to get so close.
Was it 240 in the county to 179 in the city?
Total, I was looking at the sped referrals. So in the county, it's 57, and in the city, it's 50, which isn't that different. But I mean, 7 kids could make a huge difference depending on where they're placed too. If you look at referral source in the city, DOE is 36, and in the county, it's 46 cases. But that could also be sped, that could include sped wrap cases. So we could look at that a little bit, look into that a little bit more if you guys want. Okay, anything else about expenditures? All right, so let's move on to demographics. Is there anything that we want to do around this?
Our implicit bias training on the road.
What's that?
Yeah. Do more advocacy for schools or child serving organizations to participate in implicit bias training.
I wonder, I honestly wonder if we didn't connect it to mandated reporting training. Somehow connecting those things, you know, and it's up to you guys. I'm not the expert, but I really like for people to say, oh, realizing I have implicit biases and then connecting it to something that they might accidentally be doing, I think what could significantly lower the number of referrals or the way that they're referred. I don't know. Mandated reporting is so, if you have a tiny hunch, it's almost set up for implicit biases. And I'm not saying we can change it or should, but I don't know. I feel like they're connected just the same way, like what we experience at, or what I experienced as a manager at Region 10, watching it is people overreacting to the affect and behavior of people of color, like experiencing it as so scary. And I wonder if that same concept doesn't play out in mandated reporting, which I know is hard to touch because if in doubt, report.
Mhm.
So I don't know, maybe we could ask some national specialist, but
it's also like not just child welfare, but just thinking about day treatment programs or things like that. Like how do kids get,
like
what are those
learning how
factors, how that impacts referrals to those additional services?
that's what I'm talking about. That's what I'm saying, Misty. I'm not saying train DSS staff. I'm trying to train us who are doing the mandated reporting, CSB, schools, neighborhood, you know, outside of DSS. And we can train and encourage, they already are. Schools, I'm sure, do implicit training. We do too. But never once have we connected it to mandated reporting. So I just put it out there and people can think on it. I don't want to board you guys or make you stay longer, but I just, like, when you look at this data, the real problem is what Martha describes in the juvenile justice system. Too many people knocking on the door, too many people of color having to, you know, that we want it. And so, I don't know, just a suggestion or
Nita,
something to think through.
yeah, I don't know about the mandated report. I mean, it makes me queasy thinking.
I
about
know.
it. But there's a parallel in that we go back to the root of the issue, right? The pond water, if you will, and it's the classroom. It's not interventions. It's not the referral for special ed. It's the classroom. It's the classroom teacher and the relationship with that kid. And as Misty, that you pointed out, you know, it's the eye tracking, you know, it's like starting there before the referral. So I think there's something there, and that's what we've been focusing on with culturally responsive teaching, the responsive classroom, building relationships versus doubling down on disciplinary kind of stuff, right? But certainly, I mean, I hear you, and it is going to the root, and I'm not sure how we can all get behind it as much as reporting back out on what we're doing, but yeah. it does
Well,
make-
or even, yeah. I just give you an example. We took a look at when we called the police, right? Because Region 10 has called police all the time, especially now. We get bomb threats weekly. Yeah, we're calling the police more on people of color than non. And that's sort of like the adult equivalency world. Have I changed that? I don't know, other than talking about it, pointing it out, like pushing people. So maybe it is sort of connecting in our agencies, that kind of conversation. Like, this isn't, implicit biases isn't just something for your personal journey. Like, there's connections and impact in it. I don't know. And maybe we have no clout. I'm done.
No,
I'm sorry.
I
I
do
want to
think-
end on time too.
No,
I
no, but
really do.
But I do think there's room for connections. Like, we don't have SROs in our buildings anymore, school resource officers. As a direct result, we've seen the data. The kids' behaviors gets criminalized, and kids of color in particular. And that was one of the impetus behind that change. And it's no fault, right? It's just the bias. It's not a personal slam. But I do think the more time we spend on connections like this, like, oh, SRO to referrals,
Right.
criminal, the courts, and then to DSS, I think it's worth it. I wouldn't want to, and I think it is rubber hitting the road with the training. So I support the connection work. And I
Yeah.
think there's a lot more out there that we haven't talked about.
Okay, so besides training around implicit bias, is there anything else that we want to note as a response we might pursue to that? Some of this, I think, also ties into our strategic plan.
Agreed.
So I'm just going to note that as well. And then in terms of cans, is there anything that did we want to look into that a little bit more if we can? I don't know what information we can actually get besides what we've already picked up from the state website. It's an interesting observation. I don't know what we can do to look into that more. Jennifer, do you know if there's anything, if it gives us any more detailed information about cans and how they're being recorded?
I'm trying to look now. I'll let you know.
Even it's just like, can you guys double check this number?
Mhm.
Like, can you run that report again for us, or can you make sure it's not a typo? Kind of thing.
Okay, and then anything to note about utilization of ICC or community-based services? It looks like we do a good job with those in the first place.
Keep up the good work.
It said we had continued to monitor, so I'm just gonna keep that.
Okay.
And that's all we need for the CQI tool, I think. Thank you, guys.
Okay, so next we have the work plan update. So how do we want to go about doing this? What is this, like, part of the strategic plan is that we annually at the retreat update?
Yeah, so we revised the strategic plan so that we can have a space to talk, to make notes of discussion and kind of next steps. And the retreat is when we usually review and update the plan. So that was kind of the intention behind that.
So you ready to share the plan and we go through and review?
I think Jennifer and I decided she would share maybe, and I would take notes again. And I don't know who wants to lead the discussion, but
I can. All right, did that work? Okay. And so you're going to take notes under status just to see what we have any next steps. So have we made, is this something that we need to add to, or is there some activity that we've had to further increase our engagement with our judicial system? What other things do we want on here? I know we haven't been focusing on this.
And I feel like this has sort of been paused since COVID, and I'm not really sure that there's much changed since then. So it may just be worth noting that, you know, that you all reviewed this goal, whether or not you want to continue to maintain it. And then I'm not sure that there's really a lot more that can happen with this particular goal. But I don't know if Martha feels differently about that, or Krista. I mean, there's some shuffling around that's going on with the judges.
Yes, there'll be some changes as Judge Pareto is going to circuit court in December, I think. And Krista, if I'm wrong, please correct me. And I think Judge Berger will be more involved with the delinquency dockets. Not sure about the foster care dockets. Krista, do you know about those?
I haven't heard about the foster care dockets.
So is it worth educating these judges that are coming in about CSA? And how would we go about doing that?
So Krista and I should be meeting with Judge Berger, I would say within the next 2 or 3 weeks. We've gotten some available times from him, and we can bring that up in our conversation and see what his comfort level is. I mean, I think he's really going to be the driver of it.
And what about Judge Pather? Areshni?
She'll be coming on in, I guess, December, when Judge Pareto goes up to circuit court.
Gotcha.
And again, I don't know which dockets she'll have. And Chris, if you have anything to add, jump in. I mean, she does experience with the Family Treatment Court and is, I think, chair of the Family Treatment Court board right now.
I feel like she will be doing like child support, custody perhaps, seems to be what I recall. So it's the foster care docket. I don't think I heard anyone really say who would be handling that docket.
Wouldn't help me understand / remember the benefit of having a judge be aware of what CSA does is so that they can make referrals or know what resources are available. Like, what's the hope if they're aware of CSA and what we can and cannot do? What's the end goal there?
One would be that to keep them from ordering stuff that we can't pay for.
Okay.
And I would say typically when we're recommending services, we state in our social histories or advise them the funding source that can be used, or try to correct them when they or want something where there's no funding source or that's not CSA eligible. So we try to do some education around that. Judge Berger really likes to know details. So it might be something that he would be interested in. Like Martha said, we can mention it to him and figure out.
Or I think sometimes it's like, you know, a kid doesn't have to come into foster care in order to pay for X, Y, and Z because we can do foster care prevention, or we can do it through Region 10 or whatever, and they don't need to come into foster care. I don't know that, like, you know, I think especially if we look at Region 10 or even like Sped Rat, like, you know, something outside of DSS, there are agencies outside of DSS that can access CSA, and the kid doesn't even have to be involved with DSS necessarily. Or especially, you know, if we're talking about using non-mandated funds, those kids don't need to come into foster care in order to be able to access that funding necessarily. I think that's a big part of it too.
Great, thank you.
Mhm.
Are we ready to go to the next one? Katie, do you have what you need? Just sort of like, yeah, waiting for the new mix. What's our next one? Onboarding of CPMT members.
So yeah, I mean, Katie and I are working on the acronym list has just been a little bit of a bear. So we are working on that. And then we can definitely make it a priority as we have like private provider reps coming on and things like that. So hopefully.
I think for us, there's just been other things that have maybe taken priority over this recently. It is something that's on our list of things to work on.
So we'll have new people soon. So then you guys can just update us on what you need from us to make the onboarding better and to, like, as we bring on our new provider rep, we want them to do these things, right?
I also,
Sorry, go ahead, Misty.
I was just saying, could we sign the anti-racist statement as a step for onboarding underneath strategies?
Strategy. One of the things I was going to do is reach out to our current FAPS representative, since she's coming off, and say, you know, looking back, what would have been helpful for you. So that's part of what I was going to do.
Does there need to be for a strategy, like how long that orientation is, so to speak? Like when do they need to complete those tutorials? I don't know if that needs to be in a strategy or that's just like in the tutorial or the actual program guide, for lack of better words.
Like they should attend those meetings and do the tutorials within the first 6 months of their membership.
Right. And I guess, does it say too, then how often do you need a refresher? Like, I know it was talked about before, if I remember correctly, like, do we need to go back to look at the tutorials or anything along those lines? Or you should do something once every new moon? I'm kidding, like once every 2 years or something.
Making use of tools on the CSA website. I feel like before I rolled off of SLAT, we were working on some things that should be helpful for new folks in those roles.
The state, there are tutorials that we were going to incorporate into our training packet.
There's also the parent one that the state just came out with, or OCS. And they release a parent, like here's your role and here's what's the CSA system is and here's your role.
For the parent representative or for a parent?
For the parent rep.
Yeah. So I think, you know, because some of the trainings are specific to like a CPMT member. So I think we would break it out depending on the role, which ones are helpful.
That'd be great.
Because like the CANS training, who is that really, helpful for?
Okay, we ready to go to the next one? Let's do it.
Again, I feel like this particular goal is really just you all agreeing to commit to continue to bring those issues to CPMT to advocate for as needed.
Yeah,
What is this goal?
this is a legislative advocacy goal that CPMT will be actively involved in legislative advocacy for issues involving CSA, which I think we do when it's appropriate and something comes up. And this has been the off General Assembly for the budget. So, I mean, to me, nothing changes other than ongoing unless people want to add something.
Works for me.
So here, I mean, I would just say we have to do because that's just what OCS says. So we do that, which we just did earlier. So that CQI tool, we'll continue to do. I feel like having Bob and Kevin come and sort of give you guys that information the way you've asked. I don't know that we can necessarily change the reports super easy, but I'm hoping that just their way of presenting it has been helpful for folks.
Really?
So I don't know if there's something additional that would be helpful for you all as they're going through those reports, but we could look at adding something like that if it is.
Those are the one reports that have gotten better because they're on Zoom and they're sharing Zoom. So when we get back in person, then it's, oh, I can't find the sheet. Might be nice to project it.
Mhm. Agree.
I'm looking at B under strategies. Did we need to keep all of these? Or do we feel like we've done some of these?
I feel like we revised the financial reports, did we?
Mhm. Well, we revised the way he reported them and highlighted things, right? Not sure we.
And I know Bob was going to add something to the city's report that was asked for. I'm blanking on it. Sorry.
Remember
We weren't
either.
reporting cost per child, so I think you
Mm.
added that.
I mean, I think the comparisons between the city and the county is we compare one report to the other report.
I agree.
So I'm gonna take that off. Racial disparity within CSA mandate types. Do we want to ask if, I don't think we included that. And we can certainly ask if that's possible to do, to show.
Wouldn't we use the CQI tool to do that?
So I feel like the data that we brought today shows the mandate types and then it shows race. I don't
Oh,
know if we can figure out race within each mandate type. Like, I just don't know that the city or that the state gives us that kind of data easily. And, I don't know how we would do that easily.
that's that disaggregating that we would like to do, but don't necessarily know how to do.
Or yeah, or even like how we can do.
Would it be possible to ask OCS whether they could disaggregate the mandate types by race? Or are we pretty sure they'd say no?
We could ask.
Good ask.
Never
It would
hurts to
be
ask,
interesting
right?
information. I would like to know that information.
Even just to know if they do that.
Mhm, right.
Do our monthly reports even have race on them? Or, I know they have mandate type.
You're talking about the CQI reports?
No, I'm talking about the monthly financials.
No, they don't.
Oh, I see. So maybe we can just leave that as like a review item to ask OCS if we can do that and then decide from there. I mean, I don't think it could be added to like the financial report that Bob and Kevin send out, but there might be some other way to do it within OCS. It feels like a good thing to ask. It doesn't feel relevant to the financial reports. I guess I'm just saying that out loud. I mean, I would like to know. I think it would be interesting, but I don't think I don't associate it with the financial report. I mean, as we disaggregate this data, we could potentially like partner with the School of Engineering and do a research, they can combine data, ultimately, if we were so interested. And I know at one point we had asked Tamra, who was the program manager for the Office of Program Accountability. I don't know if I got the name right, Mary. Anyway, we had asked her about sort of taking on this project to really figure out how we could go about doing this. And she was pretty clear in saying, like, this is huge. This is a great big old kind of project you're talking about. And so, I don't think she felt like that was manageable within what she could do herself. So I do think if you're talking about something like that, it really would be a big project. I do too. But maybe OCS should just break down by race in the mandate types. And they may. We can definitely ask. Is there any changes we want to this goal?
I know that there's like work that's been done on those the provider feedback from Fable. I still think that they're work in progress, right?
So the surveys have been implemented for 3 quarters now. So we've been doing the feedback about providers for families. We've not worked on the feedback from case managers or to determine if and how to best collect and utilize data from providers.
Okay.
Which I know that last one about the data from providers, I feel like that has come up as part of our audit, that's some information they're supposed to report back to us. And so probably at some point we're going to need to figure out how to get some of that information. I feel like for some of those larger agencies, they're already doing that stuff, so it's not a big deal for them. But for some of the smaller, like the independent mentors and things like that would be a huge load for them. So I think they would definitely need some support in how to be able to like report that information back to CPMT. So that one would definitely take some work.
So it seems relevant though to leave that on.
Mm-hmm.
Yeah.
Yeah, and I know there are some localities that ask for that information as part of their annual contract renewals. Like part of their contract packet is fill out this form with this data that we want to know about your agency and outcomes. So, I mean, I think in the future, maybe that's something that we could do. Again, I just kind of go to this place of like, okay, so they do it, and then what do we do with it? I want to make sure if we're spending our energy developing something like that, that there's going to be a purpose and use for it.
Agreed. And yeah. When you collect outcomes, we've got to figure out what's a significant outcome, not the provider, because the provider will figure out an outcome that is successful completion of ISP, which
Yeah.
is difficult to work with. That's not, it's.
Well, and it, it depends on what we want to see and what we want to measure. I mean, we can ask providers, describe how your agency is looking at diversity, equity, and inclusion.
Yeah.
And like maybe that gets, I don't know, that gets screened somehow. I don't know. I think we could ask for whatever we want to ask for. And see what they're able to give us.
And then there's a question about whether you all feel like that would be a task that might be best suited for a program. I don't know. But just as a looking at the status and next steps, that might be, because that's where the other survey came from.
I like that suggestion, Jennifer, because I feel like program would be anticipating needs instead of looking back at what happened last year. And might be able to get more useful information.
So what would the ask be of program? What we actually ask them? To
I think maybe we could present them with, if you look at C, the strategies under C, the mechanisms for families, they did that. I think we could present them with the mechanisms to gather feedback from case managers, or the determining if and how to best collect data and utilize data from providers. I think, I don't know that program would want to tackle both or be able to tackle both at the same time, but saying, hey, would you guys be able to now help with one of these?
I think that'd be great.
So Krista, maybe we can take that next month. Back to program. Krista's still on here.
Yeah, we can do that.
Sorry, I can't see everybody.
I'm here. Yes, we can do that. Put that on the agenda.
We're good to move on?
Yep.
Last one.
Well, we've made progress. We wrote a DEI statement.
Question about that. Where is that going to live? Like, where does that need to be? What do we need to do with that?
Would we put it with our contract, even if it's just informational? As people sign a contract, then they get that as well.
Thinking it goes in the policy manual, but maybe that's not the best place for it.
I mean, do we want that on our website? Are we going to expect our providers to sign it, or are we going to send it to them as an FYI? This is what we expect. This is, what we have committed ourselves to, and we expect, from our providers.
I mean, I think the providers already signed the multicultural agreement with the CSA contracts. This is embarrassing, but I didn't know that we had a website. So I think that sounds great. I don't know if we're at the point where we have providers sign that. I think it's specific to CPMT and our role.
Okay. That makes sense. I just wanted to get.
But
some
I am
clarification.
noticing here that we should probably share it with program members and with FAPT members. We have not done that yet.
And ask them to sign.
I think so.
It's something else that would be included or would be read for people that are applying for positions either on.
Oh, yeah.
Right.
Yeah, and so for the FAPT private provider rep interviews, we definitely included a question about that, and we'll be sharing that document with them as part of what we send them, along with the community practice model.
Is there a way to, did you say you added a question on the provider and parent rep applications?
No, for the private provider interviews that we're doing, hopefully
Oh,
next week,
interviews.
or the week after. Within the next 2 weeks, we should hopefully get them done. We added a question about that to ask folks.
So we can delete, write a DEI statement, and maybe we should put review our DEI statement at annually or something like that, and to be included in the policy processes and materials still, but that we would review it annually and refresh signatures if we need to.
Mhm.
I think that sounds great. Anything else we need to do with this goal?
One other thing, do we need to say, have other trainings for us annually or something along those lines? I don't know.
Yeah, talking about A at the top, maybe we can commit to doing something always in conjunction with our annual retreat, or
That's a good idea.
Mhm.
with just something specific that we can hold ourselves to. I think we could, maybe include any sort of sharing of resources and opportunities as part of announcements, updates, whatnot. We'll continue to review this plan, right? It's already in our standing agenda item. So this will continue to be reviewed, but maybe we could specifically say, like, we will do a collective training or workshop related to this annually at the retreat or in conjunction with the retreat.
Sure. Is there like a part 2 of the groundwater training?
There is. I just did some research online. There is, and I can't, Ashley, I think said that. So there might be a part 2 and maybe bringing it again for the first time around again. I think the part 2 is more of a debrief, because what the thing doesn't do is talk about action planning around it.
Right. It is a lot of kind of information presentation versus reflection.
So am I good to stop sharing now?
Mhm.
Okay.
All right. I like that annual training together of the DEI lens. And we can just do it as close to the retreat as possible. Okay. The only other things we have on our agenda is discussion of meeting time date.
Yeah, so I was just bringing this to CPMT because here lately we struggle at the county to meet our quorum. And I know that it's problematic for like Ryan, who has Board of Supervisor meeting. And this consistently conflicts with that meeting. So back in the day when CPMT, I guess, first set this meeting, it actually was at, I think, 3 o'clock, and then it got moved to 3:30 to accommodate a CPMT member. And that's just where it's landed ever since. So it's not like there's some specific reason that it has to be the third Wednesday at a certain time. It's just what worked back then, but I feel like it's gotten harder for it to work for folks here lately. And so I just wanted to bring it up. I know our parent rep has struggled to make this meeting. And so I've asked her just to have her input about this. And what she said would work best for her would be early mornings on Mondays or Thursdays. And so again, just being mindful of other folks' schedules. Like it's a little bit hard when it's, as many members as there are, and it's a joint meeting between the city and the county, like it can be difficult. But I did at least want to bring it up with folks to try to maybe review, if it's not the day, then the time, or however, to just kind of put it out there.
There are holidays that fall on Monday that sometimes might conflict with meeting, and I don't know if those are allowed, like city council meetings, if they fall on a Monday that happens to be a holiday, then it's just agreed upon that they do it on that Tuesday or however. But I wouldn't be opposed to Monday mornings. It's just that we might bump into holidays. So
Mondays are hard for me because I have FAPT.
oh yeah.
And I have leadership team every Monday morning. I could try and get them to change, but it's a lot of schedules.
I think Mondays would be terrible for us.
Yeah, okay.
Yeah.
So I'm not, I'm
Maybe
fine with,
consider space and having to meet in person at some point in time. Like at one point in time, we had talked about having to use, there's like one city meeting space that it allows for electronic meetings. So we had talked about looking to see when that space was available. I don't know if that's still an issue or not.
not until September.
Mm-hmm.
I just looked at my calendar. I mean, Thursday mornings would be fine for me.
Thursday mornings would work for me.
Thursday mornings would be better for me than Mondays.
Yeah, Thursday morning is probably the only morning I have. I can't do any, and the other ones I just can't see rearranging, but I could rearrange Thursday morning.
What week of the month are we talking about? Sorry, this week?
The third Thursday still do the third week.
So the July meeting, starting with the July meeting,
We can't, that's our staff meeting.
third,
8:30 to 10, third Thursday of the month, 8:30 to 10 is agency staff meeting.
What time is the Board of Supervisors meeting on Wednesdays? That's the meeting that's problematic.
Started at 1 today,
Oh,
I think. I don't know, I never go.
I think it's normally like around 3, unless like they have
I mean,
other.
it starts, I mean, it's hours, you know.
Mm-hmm. That's why I was wondering what time it
I
starts.
think it starts at 1.
So I was thinking if
I could look it up.
we just pushed this meeting earlier, would that work? But it doesn't sound like it.
What about the second Thursday of the month? In the morning? Yes, or in the evening.
That's typically our staff meeting, but it's, we only meet quarterly. But I'd be out, Misty wouldn't be out. Katie and I could talk about it.
So again, at this point, I'm really just kind of putting feelers out to see, because like I said, there's obviously other members that aren't here that might have, conflicts with what we're proposing, but I just, it just seems like it's becoming more problematic and getting harder for us to get to a quorum. So I thought it would be a good time to bring that up. And like I said, I checked in with Michelle about why it wasn't working for her. And it really is the day and time that's just not working. So
Does it have to be like, could it be at like 11 to 12? How long are our meetings? An hour and a half, right? So could it be like 11 to 12:30 on a different day of the week, like Thursday? Like how early in the morning does it have to be to not conflict with the other things?
So maybe what we can do for next month is just say we're proposing I don't know, I mean, would the first Thursday make a difference versus that sounds like the second might not work for city. The third doesn't work for county, or even the fourth Thursday. I think if we could just sort of narrow it down to like this particular Thursday, is there a window of time within 9 to 12 or whatever that that people might be more available, and then just try to get feedback from the other members as well.
Not to make.
And I will
more
say,
I was gonna say, could there be like a doodle poll or have it so people look at it before that meeting? So that way we could make a decision, right? Because
Like something happened with Doodle Poll.
no,
I
then
can't
no.
remember.
I act like I do a lot with it. No, but I was just trying to figure out a way.
Can you do like a vote through email?
Yeah, you can somehow. I've never done it.
I don't know that I've ever done it either. I've answered them. I don't know that I've ever set them up.
See here, options.
Maybe we
Use
could
and I
voting
just
button.
checked.
first
What are
Thursday or
options?
the fourth Thursday and the times we could do and see what happens.
So just at least for the folks that are here, would the fourth Thursday maybe be an okay day for?
I generally have a meeting from 9 to 10 on the second and fourth Thursdays.
Okay.
Could you meet at like
And
10:30?
potentially get off that. And that would be probably fine with me, but as it stands right now, I have a meeting from 9 to 10. And I have a meeting from 10 to 11 every Thursday.
Okay.
But I could probably get that one changed. We could probably find another time for that.
All right, so you want to put out something in email, Jennifer? And Katie, and then we'll just, vote on it or everyone can weigh in. Okay, we got 2 minutes.
Just one last thing. Yep.
Routine foster care expenses.
Any questions?
Do you need a motion?
I don't think so.
Good, because I'm out of them. All right. Whew, we got through it.
Good job, ladies.
Yes. Thank
Right.
you all.
See you all later.
Be well.
But our July meeting is gonna be on the same thing on the Wednesday, right? And then and then August would be the new.
Yeah,
just
we'll
making sure. Okay.
talk about it at the next meeting. I won't be there, but everybody else can talk about it. I'm good with whatever.
Sounds
I
good.
think I may be on vacation too.
I'm on vacation too.
Uh-oh.
Great.
May need to
Great.
weigh in on that one too. I'm pretty sure I'm on
Head out
vacation.
that way.
Electronic communication.
All right.
All right.
Bye all.
Bye.
Bye.